AB 1975, My Food as Medicine bill, is an example of that. I also ran another bill that focused on ensuring that you could have mobile farmers markets and purchases that you make from mobile farmers markets be available to people who receive WIC benefits, so that you can use your WIC benefit card at a mobile farmers market, which is, again, this idea of let's just put food into the hands of people who most need it, and everyone needs to make sure that they're starting from a place of feeling fulfilled in that way.
Can you explain to us what food desert, what does that mean?
I shared a little earlier that I grew up in New York City. I worked with many children in New York City and later in Connecticut who lived in housing developments where they were so isolated that they'd never been to their capital. That was literally the beautiful building that we have in the state of Connecticut. They have a beautiful building too, and children and families, even though it was 1.5 miles away, didn't even know it existed. And so there's a part of poverty that is really focused on trying to combat isolation that is so critical. And the reality is that family can have 4 liquor stores available to them and 0 supermarkets or food markets or markets that offer fresh produce. And that is a food desert where you just don't have the ability to quickly and readily access food, healthy food.
You mentioned this kind of convenience stores. They're more expensive as well than the grocery stores.
So we need our convenience stores. Our convenience stores are often small business owners who are largely invested in their community. Many convenience store owners live, within blocks of where their actual store is. The kind of food that they have there, though, is, they go through the process of doing their own micro-targeting and marketing to see what is more accessible. I walked into my local convenience store and I could easily get a Twinkie or a Hostess cake. I'm kind of dating myself because not many people know what those things are now these days. But I couldn't likely get a banana. And so our convenience stores really market to what they know people will decide to consume. And so it is not only about making sure that food is accessible, but also creating awareness and education around the importance of nutrition to be able to support and sustain our overall health. One of the challenges is when you're living in a food desert and you are already in a zip code, if you will, where you're likely to have poorer health outcomes, you are more likely to experience things like diabetes, heart disease, respiratory illness, cancer. There are already things that are going around in the environment in that particular community that also are compromising one's health. And so it's kind of a double whammy for a lot of people. Not only do they not have the quality food, they also are living in an environment that's not conducive to their ability to be healthful. And then I guess the triple whammy is that we may not necessarily have the awareness and the education around how to make sure that we are eating and behaving and operating, going for walks, making sure that we're getting the kind of exercise that we need to be able to promote healthful lives.